Negrini is presenting, not Dr. Zaina. Ladies and gentlemen, good afternoon. This is the disclosure. Previously this year we presented the Cochrane review in which we found only two serious studies evaluating bracing. In this Cochrane review we also proposed to look at the SRS criteria for bracing and look at the papers presented according to the SRS criteria that can give some reliable results as well. There are two kinds of bracing criteria that have been proposed. One are methodological by the SRS for the research studies, and the other one are about management criteria presented by Sosort. And the aim of the study is to evaluate the effectiveness of bracing according to the Sosort criteria and the SRS criteria. This is a retrospective study coming from a prospective clinical database starting in 2003. According to the management criteria, the treatment was excellent. According to the SRS criteria, we included only AIS, 10 years older, and COP degrees between 25 and 30. You can see here the patients included, 48 patients, mean age and COP degrees. Treatments applied were, in two cases, research casting before brace, and in two cases, exercises only, while the rest of the cohort has been treated with bracing plus exercises. The outcomes, the main outcomes, were according to the SRS, progression of 6 degrees or more, 45 degrees at the end of growth, and fused at 2 years follow-up, and the statistics. Treatment lasted for 1.2, and the compliance rate, this is not been recorded with a compliance meter, but it has been declared by the patient, was up to 90% in the median. The outcomes, we didn't have any patient over 45 degrees at the end. We didn't have patients fused at the end and at 2 years follow-up. We had 2 patients progressed, and more than half of the patients improved. The 2 progressed patients had both thoracic curve, and they started between 25 and 30 degrees of range of COP degrees and research 0 start. This is the best result we had in this series. This is an average result, and this is a result on the highest level curves. There are very, very different results of the studies published according to the SRS criteria. There are papers presenting no fusion, no worsening, no end of growth over no patients over 45 degrees, while at the other end there are papers presenting more than 60% patient fused at the end of growth or at the follow-up, with some paper in between them. Why these differences? For sure, we have to look at the type and quality of braces. And just to give an example, there are spine core papers that are exactly between the two opposite that are TLSO braces. And the dropout, all these papers are prospective apart from the spinal cord brace, and this for sure imply a lot of problems, and we have to look also prospectively. We are preparing one paper on that. And compliance. Beyond the brace, compliance is not a property of the brace, it's a property of the treating team. And it is our goal to obtain compliance, and the Sosort criteria exactly focus on that, management of patients. In conclusion, in this study, respecting the SRS and Sosort criteria, it is possible to avoid surgery in most cases, stabilize most of the patients, and obtain also some improvements. Thank you.